let's get to look at the concept of atrial fibrillation. And atria, everybody knows the atria. Those are the what? Upper chambers of the heart. And when you're talking about fibrillation, that means in a normal way, where impulses are being shipped or transmitted from sinoatrial node to the AV node to the bundle of His to the Purkinje fibers. Now, you're having an abnormal firing, okay? From left, right, center, nothing is coordinated again. So if you say that's fibrillation, saying atrial fibrillation, you are simply trying to say that what? Okay, there's a problem or there is this problem in the body, but it is actually what? Originating from the atrium. Okay, so atrial fibrillation happens when abnormal electrical impulses suddenly start firing in the atria. These impulses will now override the heart's natural pacemaker, which can no longer control the rhythm of the heart. This can cause you to have an irregular pulse rate. Okay, so I've already explained this picture, right, in the previous one. You see that there's abnormal firing, left, right, center, and it is actually originating from the atrium. That's why I say there's atrial fibrillation. Okay, so this is the most common sustained cardiac arrhythmia in adult population in the UK's. The prevalence actually rises with age. Okay, it's a complex arrhythmia which is characterized by abnormal automaticity. All right, and there's multiple re-entry circuits around the atrium because normally pulse should be conducted in one way direction, but if you have pulse re-entry, can you see these cycles? Those arrows going in cycles shows that the pulse when conducted still comes back. Okay, that's what it will cause atrial fibrillation. Atrial fibrillation may be classified as what? Paroxysmal. That's when it is what? Has a sudden onset and is short lasting. It could be persistent, long lasting. It could be what? Permanent. Okay. When you take an ECG of a patient that has atrial fibrillation, it will show there's an absent P wave. All right, absent P wave. And you see the QRS complex. The QRS complex is not like the normal one. Okay, so you have an irregular QRS complex. Right, atrial fibrillation can cause palpitations. Right, the heart will be beating, and the patient is aware that their heart is beating. There'll be breathlessness. There'll be fatigue. It will produce an irregular pulse. Okay, so when you take the pulse, you see that the pulse is not full volume. It is not regular. Okay, so in patients with poor ventricular function or valve disease, it may precipitate or aggravate heart failure, but may be asymptomatic in patients that don't have this what? Other underlying disease conditions, right? It may be the first manifestations of many forms of heart disease associated with what? Atrial dilatation. Okay. Patients with atrial fibrillation should have ECG, echocardiogram, thyroid function test after you have taken history and physical examination from them. So dilated, okay, sorry. This cardioversion can be used to restore um, normal sinus if the atrial fibrillation is less than 3 months. Okay, digoxin and beta blockers or verapamil or diltiazem can be used for rate, that's heart rate control. All right, so I think that's it for atrial fibrillation. We just had an overview of the concept so that students just know what atrial fibrillation just simply means. There's an abnormal firing of impulses, but it's actually originating from the atrium.